Hey everyone, today we are tackling one of the most common complaints you're ever going to hear in the clinic. Doc, I can't breathe through my nose. It sounds simple, right? But the causes can be all over the map. So, in this explainer, we're going to walk through a really straightforward framework that'll help you evaluate and manage nasal obstruction with total confidence. So the first thing to get your head around is this. We're starting with what the patient is feeling. This isn't about numbers on a machine. It's about their sensation of insufficient airflow. That feeling is the problem we're here to solve. It all begins with their experience.
All right, here's our game plan. First, we'll nail down the definition. Then, we'll dive into the two major buckets that all causes fall into. We'll walk through the clinical evaluation, what to ask and what to look for, then touch on some advanced tools, and finally, connect it all to the right treatment and the red flags you absolutely can't miss.
Now this right here is the single most important concept we're going to talk about. I want you to think of this as the Great Divide. Pretty much every single case of nasal obstruction boils down to one of two things. Is the problem with the lining of the nose, the mucosa, or is it a problem with the framework, the actual structure? Answering that one question is going to guide your entire workup.
And here's what that looks like in practice. On the left, you've got your mucosal problems. This is all about the tissue itself, right? Inflammation from allergies, swelling from a sinus infection, maybe growths like nasal polyps. But on the right, you've got the structural issues. This is pure anatomy, a crooked septum, a weak spot that collapses when you breathe in, or just big, bony structures taking up space. This is your mental model, your first sorting hat for every patient.
So the big question is, how do you actually figure out which bucket your patient falls into? Well, the good news is you don't need any fancy, expensive equipment to get started. It all comes down to the two most powerful tools you have, asking great questions and doing a focused physical exam. Your history is like a diagnostic filter. Let's play it out. If a patient tells you, yeah, it's on both sides and it gets way worse every spring, you're already thinking mucosal, probably allergic rhinitis. But what if they say, it's just my left side, it's been like that ever since I broke my nose playing soccer? Bam! You're immediately leaning towards a structural problem like a deviated septum. And always, always ask about nasal sprays. That overuse is a classic sneaky cause of mucosal swelling.
Okay, now for the exam. It's really just 3 simple steps. First, just look at the nose from the outside. Is it crooked? Can you see signs of an old injury? Second, do the Cottle maneuver. You just gently pull their cheek to the side, opening up that nasal entrance. If they take a breath and their eyes light up because they can suddenly breathe, well, that's a huge clue for nasal valve collapse. And finally, grab your otoscope, just like you'd use for an ear exam, and take a look inside. You can see a ton, a deviated septum, swollen boggy turbinates, you name it.
Okay, so you've taken a killer history, you've done a really solid exam, but for some patients, the picture still isn't totally clear. You're still scratching your head a bit. This is where you might need to bring in the big guns to get a better look.
And that brings us to a super important question, especially when you're just starting out. It's tempting to want to see everything, right? But do we really need to scan every single person who comes in with this complaint? What do you think?
The answer, in big bold letters, is no. For the vast majority of cases, like simple allergies or a deviated septum that you can see on your exam, you just don't need a CT scan to make the diagnosis and start treatment. Your clinical skills are often way more valuable.
So when do you order one? Well, you save it for these specific situations, when the diagnosis is still a total mystery, when you're worried about something serious like a tumor, especially if the symptoms are only on one side, or when a surgeon just needs a detailed roadmap before they go in to operate. This is about being smart and targeted with your imaging, not just ordering it for everyone. Now this is where it all comes together. This is the payoff. Because that diagnosis you just made, using that whole mucosal versus structural framework, is going to point you directly to the right treatment.
And the logic here is just so beautifully simple. If the problem is mucosal, it's an issue with the tissue, with inflammation, with allergies, then your primary treatment is going to be medical, pharmacologic. Intranasal steroid sprays are the workhorse here. But if the problem is structural, a crooked septum, a collapsed valve, no amount of spray is going to fix that. The primary treatment there is surgical. It's just medication for the tissue and surgery for the framework. It's that simple.
All right, let's wrap this up. We're going to summarize the absolute key takeaways, and then we're going to cover arguably the most important part, the red flags. These are the signs that tell you it's time to pick up the phone and call for help from a specialist.
Seriously, you need to burn this slide into your memory. Any symptom that's only on one side, especially if you see polyps on just one side, should make you immediately think about something more serious, like a tumor.
And any sign that this problem is spreading outside the nose, we're talking double vision, a bulging eye, facial numbness, or bad nosebleeds you can't explain, that is an absolute stop what you're doing red flag. These patients need an urgent referral to an ENT specialist. Period. So, let's leave it with this. The very next time you walk into a room and your patient says, "I just can't breathe through my nose," what's going to be your first question? What's going to be your first move on the exam? I hope this explainer has given you a clear, confident, and really effective plan to find that answer. Thanks so much for joining me.